Hi, my name is Conway, and this week I'll be covering the education and health topic. What role does education play as a social determinant to health and protect us from health problems in later life? So education, what is it? Education is the experience of learning new information about the environment around us through our experiences and direct interactions. When we look at education and its effects on human health, we can view it in two different ways. That is, the quality of the education given and the level of the access of the education that the person has. And now note that education can happen at any stage in a person's life, not just at the traditional school years that we've come to know. Quality and access, I feel, go hand in hand. Education that is good quality will deliver a rich learning experience and bring about good results in expanding a person's knowledge of the world around them. However, education can only be effective if access to it is provided. Many of us take for granted the education we receive when growing up and also now whilst you're attending university. However, inequality in access to education exists not only in Australia, but on a global scale. The effect of not receiving a good education are clear to see. Low socioeconomic areas tend to rise in populations that do not have good levels of education. Other factors may impact on the person, and this will affect the ability to actually be able to learn or just simply to attend school. Attaining an education opens pathways to better futures and better health outcomes in later life, due mainly to educated people having a higher literacy rate, specifically a higher health literacy. That is the ability to understand their health and act upon information about their health to ensure that they stay healthier for longer. Education gives a person more options in life and reveals pathways to better situations. So we can see this as better employment opportunities, higher rates of pay, better housing, better health access. Education is usually a vital policy that governments like to address, as this will decrease the amount of poverty and disadvantage, as well as reduce the burden on the welfare system. So a good example of this can be seen in Australia. The program School of the Air aims to bring education to children in remote areas by delivering classes over the air, radio or internet. Whilst this is great, the quality will not be the same standard as a student, say, in inner cities, Sydney or Melbourne school, who have access to many more resources. So in conclusion, we can say that getting a good balance of education that is relevant but also having access and having the opportunity to have access will lead to better health outcomes in later life, as well as reducing the burden on society's healthcare systems. We'll be able to live longer, healthier, happier lives. So I'd like to leave you with a question. Feel free to answer in the comments. Think about the quality of access of education you've had in your life, and then think about how different you would be without the education right now. Thank you.